Good afternoon, everyone. Good afternoon, everyone. Hope we can start today's session. Today, we are going to discuss about the psychosocial aspects in palliative care. So, I would like to share my screen. I hope the screen is visible to everyone. So, today, psychosocial aspects in palliative care is our discussion topic. And before going to the topic, I would like to start my sessions with a small case story which I have witnessed in my uh, journey here in Pallium, India. So I will read this story. This is a 47-year-old man diagnosed with CA prostate, is living with his family in a rented house. He has been taken care by his wife, and she is 35 years old. They have two daughters. Both of them are studying in 10th and 12th standard. He was a auto driver, and due to illness, he's not been able to go for work. Both his doctors are studying in government schools, and they are very much brilliant in their studies. He has registered to a palliative care with the need of pain management, and henceforth we have started the medications for his illness. But what we identified was that there was zero effect on the medications which we have provided. So I would like to discuss the story with you people, like what management and intervention can be provided in the situations. So can you please discuss either through putting comments on the
Psychological support,
yes, ma'am.
psychological support, moral
Psychological,
support,
okay, psychological and moral support was the one which was lacking. Okay, that was
spiritual support, financial support,
okay, ma'am. Okay. Any other comments from anyone?
maybe social support also required because they are young. Patient is a young patient. They may not be going out also. So because of the disease, so social support is also required.
So, like because of the illness, he may be forced to put inside his house so that he is not been able to go out and go for his work and all. Is that what, ma'am?
Yes.
Okay. So, anything else like after reading this story, anything else which can be done for this particular family?
In the psychosocial aspect, the patient may be fear of the disease condition, fear of death, fear after his death, what the family will be. Uh, all these psychosocial aspects will be more in this patient.
Definitely, ma'am, because he was a sole breadwinner of the family, and he may be fear like after his time, what will be happening for his family. Moreover, they are having two children, that two daughters, so he may be also concerned about that too. Thank you, ma'am. Thank you for your valuable answers. So here itself we can understand that how much important is psychosocial in our palliative field is. They may be coming with tremendous ill or the illness which cannot be cured, but the pain and the problems what they are facing is more than the illness or more than the pain which is often caused by the illness. So this simply amplify how much important is psychosocial in palliative care. Okay, so this is the definition of palliative care. I know you might all be familiar, the definition by WHO. So, palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, which is physical, psychosocial, and spiritual. Here also, what we are focusing more is the quality of life, and the quality of life not only in case of physical factor but also in other aspects like psychosocial, economical, and spiritual. So this is a small article which I have taken from Indian Journal of Palliative Care. So in this article, it clearly says that the quality of life for patients and the manner of their dying is sometimes more influenced by psychosocial factors than by physical status. So this statement itself clearly shows that even the quality of dying, also their life, patient's life, is not only influenced or changed by only with the physical factors, but rather than with the other factors which include psychosocial factors. So these other components also makes more important for a better life and for a better dying too. So this is a small article. You can refer it. I have given the details of the article in the right side. It is something which has published on January 2006. So this arises another question: why it is more important? Yes, we are saying it is more important in palliative care, and there is a need of psychosocial, but how much it is important? Which that is a question which I have asked. So we all know that what the patients are uh, suffering is from tremendous like life limiting or life threatening illness. And of course, when they come to know about these life threatening illness, obviously they will be having some sort of stress or which causes them to face more challenges in their life. So they will be going through some sort of or some kind of stresses or problems in their life after getting to know that they are undergoing some kind of life threatening illness. So when they face these kind of stresses, we should understand where can be improved. Like, is it only in the physical factors or something other factors are there to improve the quality of life? So we have to identify what all these factors are to improve the patient's quality of life, and not only with the patient but also with the family members who are surrounded by the patients, so that they are connected and their physical, psychological, and social components also can be improved. So, in such a manner, we should identify what all the factors are should be understood, or what all the factors have should be put into effect, which where they can get a better effect. So, from this, we will get into a conclusion that this validating this patient and the family strength will obviously promote sources of meaning and purpose supportive of the family system. So, which is a team effort which a doctor, a nurse, a social officer, and a psychologist will put together, and they will connect and discuss with all these points, that is, all the other factors which are causing them this problems, which will be mainly under the psychosocial components. And from that, we will be going to the intervention part, which is a psychosocial support. This helps in reducing the level of actual and perceived stress which can be found in the patient as well as their family, thereby reducing or preventing the psychological and social consequences in the person, in the patient, in the family, and thereby affecting the community. So, in these manners, it is so much important, like psychosocial is so much important in palliative. Total pain. So basically, when we speak about pain, we used to have this subjective pain scale where we measure how much amount the patient is having. How much pain the patient is having. But when a person says, or when a patient says that I'm having this much amount of pain, or I'm suffering from severe pain, we forget to identify or understand that there are some other components which are connected to this physical pain. For example, if a person is coming and saying to, I'm not feeling good, I'm totally sick, my whole body is aching, I'm having severe pain in every areas of my body. So what we used to identify is that at which area is the pain, and what all medications or therapies can be provided to reduce that particular pain in those particular areas of body. But when that person says that he is having pain here and there, it doesn't mean that only the physical component, but there are some other components which we sometimes miss it, or which we sometimes doesn't acknowledge it. So those components are the psychological, socio-economic, and spiritual components, and all these together, including physical component, makes a total pain. It's not just a physical pain which causes a total pain, but the overall everything together makes a total pain. So that's what is written, like when a patient report his or her subjective pain on the pain scale, it is important to remember that it's not only the physical pain is reported by the patient, but some other components or some other elements are lacking, which is something addressed with the current situation of the patient's life. So if someone addresses you a pain, just remember that it's not only the physical pain, but some other components are also connected with it. Going to the next slide. So yeah, we are having some scale to assess the pain scale of the body, right? So when it comes to the other element, I mean other components, that is the psychosocial, economic, and spiritual components, how can we assess it? Like there should there is a need of some kind of tools, or there is some kind of assessment should be done to identify, yeah, there is some kind of pain is there on all these each components. So for that, we use an assessment called psychosocial assessment. So this is the assessment sheet which we use to identify the other three components of the patient. And what is psychosocial assessment? Basically, it's an evaluation of individuals' mental health and social well-being. When it says mental health and social well-being, in both the terms comes the psychological part as well as the socio-economic and spiritual part. When I say that it's a social well-being, a man is a social well-being. Obviously, he is connected with other social groups around him, also economic aspects, also spiritual aspects. So all these together make a person's evaluations of mental health and social well-being. So we are taking an proper assessment or an evaluation of all these components. Okay, how we are taking? So basically, the aim of the assessment is to identify the problem areas. So if we are telling, yeah, he is having some kind of psychosocial issues, but we have to clear it out in which areas this, either psychological or social or economical or spiritual. So we need to have a clear picture, or we need to identify which is the problematic area, thereby which is a result of from the illness. Like due to this illness only he is facing some kind of problems, and we are sorting out through the assessment what is the problem is, and thereby may influence the well-being of the patient and their families. So when this assessment takes, or when we are going to take this assessment, first of all, we have to collect the information. Like the proper detailed information should be collected from the patient, from the caregiver, from other family members, and if needed, some of the other supportive social groups. I will tell you what are the other supportive social groups are on the next slides, coming slides. Okay, so first of all, we are taking the collecting the proper information from all sources of people. And second one is we are identifying, honoring strength, resources, and needs. So from all these collective informations, we are identifying which is the problematic area, thereby strengthening it either by fulfilling their needs or by providing the proper resources. So this is the main basic two tools which we use, or which we do, or which we taken as a process in this psychosocial assessment. So first of all, we are collecting the proper information, and secondly, we are identifying from the information which is the problematic area, thereby strengthening it or fulfilling the needs or providing the proper resources. So yes, so which all areas of assessments we need? So there are some areas where we need to take the assessments. First is the general area, which is patient and family. We are taking details from patient and family, getting to know their insight, like whether how much they know about the illness, their family structure, socioeconomic status, environmental access, psychological distress, spiritual impact of illness, interventions, and plan. So these are the general areas where we take the basic collective information. Coming to the patient and family overview, here we will take the basic demographic details like what is his name, what is his age, like is he's working right now, what was his work earlier, like who is the caregiver, their contact numbers, any other supportive groups are there or not. So this is the details which comes under the patient and family overview. Next comes insight. So insight is basically how much the patient and the family knows about the diagnosis, prognosis, and palliative care. Diagnosis, yes, it's the illness what they are undergoing right now. The prognosis is how much they know about the illness, like how much in depth they know about their current illness, and palliative care, like how much the patient and the family is aware about the palliative care. So we are just understanding how much they have an insight about all these things. Then comes family structure or dynamics. Here we use a diagram called genogram, which will be explained later on the coming slides. And the family dynamics. Dynamics is basically like how much in depth of relationship they are having inside the family members, and also with how many supportive systems they have, and the dynamics with those supportive systems, and the history, whether is there any history in their family. So all these things comes under the family structure and dynamics. So these are the basic, very basic areas of assessment. I hope it is clear. Is there any queries? Or shall I go forward?
Yes, madam.
Okay. So coming to the next slide. So as we discussed on the previous slide about the total pain, the basic components, that is physical, psychological, socio-economic, and spiritual. In the earlier slide, we told about the basic areas where we are taking details or information. And this comes what all contents are included or involved in this specific components. So when it comes to the physical aspect, yeah, as you all know, like we are assessing how much pain, all the disturbances or vulnerabilities what the patient is undergoing at present while we are interviewing him or her on the first case. So then comes to the psychological aspect. Here we are going deeper into the psychological aspects of the patient, which is his or her mental health. So how he feels right now? Is he stressed or distressed? Is he having any concerns regarding with the mental aspects or with the psychological aspects? Does there any history of any mental illness or not? Is he taking any kind of medications for a psychological illness? Due to the illness, I mean, due to after getting to know about the diagnosis or the prognosis, is he having any kind of psychological issues like anxiety or showing any depressive symptoms, etc., etc.? How is coping himself at present? Is he being able to adapt with the illness, or is he having his own kind of coping mechanism? So these all things comes under the psychological aspects which we assess through a proper assessment with the patient. So yes, we are checking his mental health. We are checking how much he is emotionally well-being with himself as well as with his family, and the anticipatory grief, like is there any grief element present in the patient or present in his family after to getting know about the physical illness or after to getting know about the diagnosis or the prognosis. So, and how he or she as well as their family cope up with by understanding these problems. So these are all elements comes under the psychological aspects. Then coming to the socio-economic aspects. So here we are assessing like how much they have been able to socially connect with, or how much they come like the how much they comes under the economical aspect. So yeah, uh, so coming to the socio-economic, so just looking whether they are being getting all these primary basic needs, like are they getting adequate food, is they having proper shelter, do they have any proper clothing, who is the breadwinner of the family, or is there is another source of income, are they undergoing any kind of debt or something, is they getting social support which includes from the local area as well as with the other governmental areas, like are they getting pensions or something from the government schemes, or they are getting other financial aids from the local government, maybe in case of medications itself, like from primary health centers and all. Now they may getting government medicines, so are they getting it or not, and how the education the children are going. So earlier in the first story, when we discussed about the story, we were telling that both his children were very good in, very much brilliant in studying. So in that case, we can say that yeah, we can do some kind of educational support for those children. So likewise, we will assess each and every aspects in socio-economic, like whether all these primary things are getting or not. So yes, these all comes under the socio-economic aspects. Coming forward, going to the next spiritual aspects, like how much connected they are with their spirituality. Are they getting the strength and comfort from those zones? Do they have hope and concerns in it? And how much meaning and joy they are with their spiritual aspect. So these are the four components which we discussed earlier, and all these contents we will check or assess all these contents in each components. Uh, is there any queries? Because from next onwards, we are going to some uh, contents of the psychosocial aspects. So with this, we have concluded the psychosocial assessments. Any points to clear or any queries to ask anyone? You can either put it in chat box. I hope everyone is clear with the content which we have gone through. Coping mechanisms means. So yeah, I got a question in chat box. Coping mechanisms. What do you mean by coping mechanisms? Okay, so we all, I mean, all individuals will be having some sort of coping mechanisms, like to come across or to get out from the depressive zones or kind of a stress. Like if for children, they will be having some kind of coping mechanisms, like they will be going to have good food, or they will be having stress free from to being stress free. They will be concentrating more in music or going for kind of dances or art practices and all. So such kind of coping mechanisms will be there for children. Likewise, as we adult also will be having some sort of coping mechanisms to make us stress free from the negative sounds or the negative things which we see or hear. Likewise, like few people will be doesn't wants to and does not interested in hearing some kind of bad news, because for them it's like, if I hear those kind of bad news, my whole day will be a very much a bad day. So what they will do is like they will purposefully get out from that negative zone or get out from hearing those bad news. Likewise, we all will be having some sort of coping mechanisms for ourselves. Likewise, even the patients, after getting to know this diagnosis, like they will be having some kind of coping mechanisms, like getting connected with people through social media. So while they're using social medias or while they're getting more into this phone, they may they doesn't think much about their illness, or they doesn't think much about their problems, so which can be taken as a coping mechanism. But yes, there will be some drawbacks also. So we have to identify whether the coping mechanisms which they take is positive or negative. So I hope it is clear what is meant by this coping mechanism. It's a kind of small tips which we use to tackle ourselves from problems or from stresses. Yeah. Anything else? Okay, I think I can go forward. So with this, we have concluded the psychosocial assessment part and how we are taking a psychosocial social assessment and how much important the psychosocial part in a palliative care. So the next content what we are going to see is the small subjects which comes under the psychosocial part, like while we are taking the assessment. As I told earlier, like in this family structure, we have seen like we will be taking genogram, we will be trying to identify the family dynamics and all. So these all contents will be addressing on the coming slides. So first we are going to talk about genogram. So this is actually a graphical representation of a person's family by addressing or by explaining the previous three generations. Like while we're taking a genogram, we will be knowing the last three generations of a patient. Why we are knowing it's like at a glance, we can understand who all are the members are. Is there any history of illness or how much they are connected with the patients? Is they are being connected more or less? So all these primary details can be understood in a single glance by looking at this genogram. So it's basically a graphical representation of person's family over at least three generations, which tells us about the structure, the dynamics, the strengths, the resources. So all these four elements will be uh, conveyed in this genogram. And the information which is included in this genogram includes the name of the patient, the age, the educational or occupation profile, and emotional relationship of the patient and their family. So all these contents will be included in the genogram, and also their structure, the dynamics, their strength and resources can be identified from the genogram at a single glance itself. Like we need not need to read all the family history as a passage, but from a small graphical representation itself, we can understand what the family and what the patient is. So for that, we have few symbols which we need to by heart actually. So on the left hand side, the first square represents a male, while the circle represents the female. And the square and circle connected with a line shows that they both are married. And when a line comes above it, it shows that they are separated. And if that line is a double line, it's a divorced family. So this is the basic symbolic representation or the basic symbols which we use in a genogram. So the square is a male, a circle is a female, and if it is connected by the line, it's a married couple. And if that line is cut down by a small slash, they are separated. And if the slash is a double one, it's a divorced family. Okay, coming to the right side, the circle with the straight and a dotted line shows that the child is an adopted one. Only with the dotted line, it's a foster child. The triangle one represents that the the woman is pregnant, and crossed one shows stillbirth. The small circle shows that it's a miscarriage, and again, only a cross shows the child got aborted. Two lines from a single point with two circles or two squares or one circle or one square, whatever when it comes from a single dot, it shows that they are having twins. Okay. Yes. Okay. So This is the symbolic representation of the members, while this is the emotional or relationship. These all things shows the intensity of their emotional relationship. So the square, the first one on the left hand side, the square and the circle connected with a single line shows that they're having a plain or a normal relationship. The second one, if that line is a dotted line, it's a more close relationship. And if it is a very double line, like a very heavily lightened line, it shows that they are very much close or they are having a very much intimacy between both of them. And if it is a red cross line in scribbled line, it shows that there's some kind of hostility or conflictual between the male and the female. And even the cross scribbled line, more kind of an intensive red or intensively scribbled line, it shows that they are having a violent kind of relationship. So the first one is a plain one. The second one, only a dotted line, shows that a little kind of intimacy only present in their relationship, while the heavily one shows that more amount of intimacy, and the fourth one with the scribbled line shows that they are a kind of hostile relationship, and most scribbled one shows that they are in a kind of violent relationship. Coming to the right hand side, the scribbled line itself, in a very darkened manner, shows that they are having, as shown in the violence, they are having a very emotional abuse, and doubly scribbled line shows that they are having kind of sexual abuse. And the last one, the dotted line, from the male towards the female, the arrow is pointed, so we can understand that kind of a little intimacy of relationship is shown from the male towards the female. So, is there any confusions in this graphical representation? Because next we are going to have an exercise which you people have to explain. Should I need to explain once again?
Please respond in the chat box.
Should I need to explain or not? I got an yes, ma'am. Ma'am, should I need to explain once again?
Mr. Sarah Selvar.
Yes, ma'am.
Okay. So, yeah, I will say once again. So the square is the male, the circle is the female, and if a line comes, if a line is connected, then we can say that yeah, they are married. And if a slash in between shows they are separated, and if the double slash it shows that they are divorced. In this itself, if it's a very light line or a normal line, it shows that they are having a normal relationship. And if that line is in a very dotted line, it means that there is no kind of intimacy or a limited intimacy in that relationship. When it comes with a double line or a very darkened line, they are having a very good intimacy or they are in a very good relationship. And that too, if the line is when it's scribbled one, it shows that some kind of hostility is present in their relationship. And if it is a more scribbled line, then we can understand that some sort of violence is included in that relationship. So this is the basic thing which you have to understand. The square and the circle is the male and the female, and this shows like they are married, they're separated, and they're divorced. And in that itself, it comes as a dotted line, limited intimacy, double line, very good intimacy, scribbled line shows that there is some kind of hostility, and very darkenly scribbled line shows that they are more in a violent kind of relationship. Okay. So this is a genogram of a patient and his family. Can anyone please explain this genogram? At least they were tried to. Yes, ma'am. Remani Joseph.
Hello.
Yes, ma'am. You're audible.
Ma'am, Kumaran and Laila both are wife and husband, madam.
Okay.
They are having one male child. His age is 45 years. Again, he is married. Sindhu, her age is 40 years. Both having two children. One Amal 8th standard, one Vimal 8th standard, ma'am. Both are male kids.
Okay.
Hello.
Yes, ma'am. You're audible, ma'am.
The Sindhu, again, I think she is married. One more person, Razu, coolie worker. He had, madam, 16 years, Sarana. He is studying 11th standard, madam.
Okay, ma'am.
Hello.
Yes, ma'am. Yes, ma'am.
Is
can
it
hear
correct,
you.
ma'am?
Some points are correct, ma'am, but there are some things which have to be more clear too. Okay, is there anyone who want to give another trial? Is there anyone?
Ma'am, just I will summarize, ma'am, again once.
Sure, sure.
This Kumar and Laila having three children, madam, two male and one female children, madam.
Kumaran and Laila having 3 children.
No,
It
only
is
one.
just little bit confusion, madam, this chart.
Okay, okay, no issues. Does anyone want to help her? Okay. So here the patient is Miss Sindhu. So here we can understand that she's a female. She's 40 years old age, and the patient is marked with scribble line. Scribble line in the sense so many lines are there so that we can understand that she is a patient. So she is the daughter of Mohan and Leela. Mohan has passed away. This cross line shows that the person has passed away. And Leela is her mother. She's 60 years of age. She's a homemaker. So this Sindhu had initially married to Raju. He was a coolie worker. He had also passed away. So in the relationship between Sindhu and Raju, they had a son. His name is Sharan. He's 16 years old age and he's studying in 11th standard. So after Raju's death, we can say that Sindhu got again married to Shaji, who is 45 years of age, who's a mason, and his parents are Kumaran and Laila. They both have expired. In the relationship between Shaji and Sindhu, they had 2 children. Both of them are twins. Twins that too male. Both of them are 13 years of age, studying in 8th standard. So this is the symbolic or graphical representation of the patient Sindhu and her family. So from at a glance itself, we can understand who all of the members is present, that is it's living, who all I have got expired, what is his relationship with the ex-husband was, and what was his ex-husband. Is there having any children on that relationship? Also, the current relationship and their children. So This is how we explain or we graphically represent a small family. Again, is there anyone who want to try? Hello?
Kumaran and Laila, they are husband and wife,
Yes, ma'am.
and they are having a daughter, Saji, 45-year-old.
It's not daughter, ma'am. It's a square one, so it's a male.
Okay, a son, and that man got married to Sindhu,
Yes, ma'am.
and they are having two children. They are twins. And on the other side, Kumaran passed away, Laila also passed away, Mohan passed away, and Leela is the mother. Mohan and Leela are the parents are Kumaran and Laila. So Mohan passed away. Now the living people are Leela, she is the mother, and Sindhu got married to Saji first and Raju also.
No,
After
ma'am. Sindhu got first married to Raju. He got passed away, and later she got married to Shaji.
So now they are having, Sindhu is having 3 children. That is Sharon, age of 18, and this, uh,
Yes, ma'am. You can continue, ma'am.
yeah. So the extended family, Sindhu, the mother is a patient. Sindhu is a patient. That multiple stripe indicate that she is a patient.
Yes, ma'am.
So she is having 3 children and the second husband.
Yes, ma'am. Okay, ma'am. Thank you. Anyone else? So here I can give you a small tip, that is, if we start with the patient, it will be very easy for us to understand better. Because when we are pointing on the patient, we can very much easily understand who are her parents are and to whom all are she connected with at present. So it will be always easier to start from the patient itself. I think one more try we can go. Is there anyone? After that, we can go to the emotional relationship of this particular family.
Hello.
Yes, ma'am.
Ma'am, Sindhu is she is the patient.
Yes,
She
ma'am.
is married with Raju, coolie worker. After that, he got one child. He is a Saran, 11th standard. After expiry of the Raju, then again she is married with Shaji. Again, she got two twins, male children. They are 13 years old. They are again studying 8th standard. Both are. Then this Shaji mother is Kumaran and Laila. The Sindhu mother and father are Mohan and Leela. Mohan is passed away. Then Kumar and Shazi family members, both mother and father, both are passed away. Then Sindhu husband has after passed, then he is married second married.
Yes, ma'am.
Yes,
Very
ma'am.
good. Yes, ma'am. Yes, ma'am. Okay, now we can go to the next slide.
In their family,
Yes, ma'am.
this is the extended family, three generation family.
Yes,
Uh,
yes, yes.
there are 5 members are the living. Then six members are living in their family, in extended family.
Yes, ma'am. Yes, ma'am. Very good, ma'am. So here we can see the first generation is Kumaran, Laila, Mohan, Leela. Then the second generation come Shaji, Sindhu, and Raju. And the third generation, we can see the three children, that is Amal, Vimal, and Sharan. Okay. So this is the simple one. And here we are going to the next slide, which shows the emotional relationship of Sindhu and her family. So yeah, who's there to go for the trial? Few more members had added to this genogram, like Kumaran's first child is also added, and we also Sindhu's other siblings has also added. Also, we can see how much they are connected in base of emotions to these family members. So, yes, anyone? Ma'am? So, is there anyone who can explain the emotional relationship of this family?
Good evening. Yeah,
Priyanka, do you wish to convey anything? Sister Priyanka?
Mr. Mohan married to Leela.
Yes,
They have a Sindhu, and Sindhu is married to Mani. And Sindhu,
ma'am, ma'am, you're not that much clear, ma'am.
is it audible? Hello?
Yes, ma'am.
Is it audible, ma'am? Mohan and Leela, their children are in Hindu, then Bindu. They both. And Hindu is married to Mani, and Bindu and Ravi. They are married.
Yes, ma'am.
Here, Hindu and Bindu's the Mohan and Leela have three children, Hindu, Sindhu, and Bindu. So Hindu, Bindu, they are sisters.
Yes, ma'am.
Here Sindhu is having married to first Raju, then they died, and Sindhu and Raju have a Sarat. After that, Sindhu is married to Saji. Saji having two children, Anmol and Vimal. Here, at the same time,
Ma'am, you're clear.
here I am talking that Sindhu is married to Saji. They have children, Amal and Vimal. And from there, Saji. Saji is the son of Kumran and Leela. The Kumran and Leela have also one brother, Subhash Brahman, and he is married to Veena. Then Subhash and Veena have violence against Sarat. That is the son of Sindhu and Raju. That is first son of Sindhu.
Ma'am, Subhash and Veena is having violence relationship to whom, ma'am?
Sindhu's first son, that is who he married to Raju.
Ma'am, is it to Sharath or is it to Shaji?
Saji.
Yes, ma'am.
Saji.
Yes, yes.
And Sarat, is it also passed away?
Pardon, ma'am, I didn't get you.
Ma'am, here also Saji also have violence to Sarat.
Yes, Shaji is having violence relation to Sharath.
Hmm.
Yes.
And here, Vimal and Sarat have good communication, good intimacy.
Bimal and Amal have good
Sarat and
communication.
Vimal and Sarat.
Bimal and Sharath. Okay, ma'am. Yeah, they are having yes, they are connected, but only in a limited manner.
Okay.
And ma'am, what about the green line, ma'am?
Green line. Green line is intensely very close. I have told na Indu, Bindu
Yes,
and
ma'am.
Sindhu, they
Yes,
are
yes.
sisters. And
Okay,
Sharat
ma'am.
also.
Okay, ma'am. Thank you. Thank you so much,
Hmm.
ma'am. So yes, we can see that Sindhu, again, she is the patient. Her parents, Mohan and Leela. Mohan had passed away. Leela is alive. They have three children, that is Indu, Sindhu, and Bindu. Indu got married to Mani. Uh, Bindu got married to Ravi, and Sindhu got married to Raju. So Raju again got passed away, and in their relationship they have a son, Sharat, who is studying 11th standard. After the death of Raju, Sindhu had again married Shaji, who is the second son of Kumaran and Laila. Their first son is Subhash, who is married to Veena. Subhash is a plumber. Uh, Subhash and Veena is having a hostile relationship to Shaji. And in their relationship, that is between Shaji and Sindhu, they had two twins, which is Amal and Bimal. Amal and Bimal is having a normal kind of relationship with Shaji, but Shaji is having a violence relationship to Sharat. Other than that, Sindhu, Indu, and Bindu, these three siblings are very much closely connected and they're having a very strong, intimate relationship. So, this is the genogram explaining three generation of Sindhu. And here we can see that the circled portion, that is, in that circle we can see Sindhu is there, Shaji is there, and these three children are there, which means that these uh, five members are living together in a house. So the circled portion explains that all these members are living together in a house. So this is the emotional genogram explanation of the patient Sindhu. Uh, does anyone have any doubts or does anyone want any questions regarding genogram and how to explain the like the relationship, the emotional relationship, and the graphical representation and all? Does anyone has any queries? So is genogram portion is clear for everyone? Can we go forward? Okay. Thank you. So yes, again we are going to echo map. So earlier we were telling about the relationship of the patient and their family inside, like the internal relationship where we were expressing in genogram. While coming to echo map, this was introduced by Anne Hartman, and here we can see or this echo map gives the explanation of the relationship of family and the family patient and their family to the society. Like this graphical representation explains the connection of patient and his family with the outer group, that is the community, or with the social groups which is surrounded by him. So as you see, it's a pictorial representation of patient's family in the social environment. It's a relationship with the larger society. That is, out of the family, they are going to the larger society. This is a snapshot view of important interactions of patient's family with other systems like social groups, extended family, individuals, organizations, and other associations. So here we can see that family unit or the patient unit is connected with so many social groups in and around. It may be either health service team, the neighbors group, the workplace group, the government services, the community services, the religious institutions which the patient and their family get connected with, their peer groups or the friends group, the clubs which they are associated with, or the schools which patients, children may be studying, and the volunteers who are supporting this patient and the family, and other health service groups. So these are the some of the social groups with which the patient and their family is connected in a society. So in this manner, we can explain a family, a patient family with other societal groups. So I think this is a simple one, and yeah, anyone can give a try. Just look into the arrows connected with and the shade of the arrows, like the normal one or the scribbled one or the darkened one, and what those arrows or the lines explains. In above itself, it's shown that the simple straight one shows the positive and the normal relationship, and the small interconnected one shows the weak. The scribbled one shows the stressful or the hostile relationship, and the arrows, like if it is the arrows shown pointed to someone from A to B, and if the arrow shown to the from A to B, then the energy flow will be from A to B. So likewise, can anyone please give a try?
The circle with the line is the patient,
Yes, ma'am.
and the left side is the husband, and the down to circle, one circle and the square. There may be one, maybe male child and the female child,
Yes, ma'am.
and the patient is connected to the self help group, and
Ma'am, is the patient is connected or they are getting support from self-help group?
getting help.
Yes, ma'am. Yes, ma'am. Because the arrow is showing from self-help group to the patient.
And the children are having support either way, from the child and the friends. They are getting connected, college and friends, and the daughter is connected to the school plus friends also.
Yes, ma'am.
And they are having a good relationship with the public health center, and
And
with
is
the
this a good relationship or a weak relationship?
weak relationship, the dot one. It is a smooth one, no, madam?
No, here it shows that it is a not a deep intimacy relationship, but a limited one. That is a kind of a weak relationship.
Okay, the dotted is
Yes.
a
Yes, yes, yes.
relation. Okay, and the wired one is they're not in good term with the neighbors.
Yes, yes, yes. They're having a hostile relationship.
Okay, from the church they are connected. The church is connected to the patient. Either way, both.
Yes, ma'am. The colleagues and husband of the family.
Uh, husband is a good term with the colleagues.
Yes, ma'am. Yes, ma'am. Also, there is a weak relationship from panchayat member to the family.
The public sector is a weak, and the panchayat members, they're having the weak relation.
Yes, ma'am. Yes, ma'am. Okay, ma'am. Thank you, ma'am. So here, as ma'am said, this lady is the patient. She is married and she has two children. The elder one is a son and the younger one is a daughter. So the whole family is getting a very good support from the church in both way. That is from the family to the church as well as from the church to the family. Coming to the panchayat member, we can see that the family receives a weak or in a or less intimacy relationship with panchayat member. And next, neighbors, we can see that the family receives a very hostile relationship from neighbors. From volunteers, they're getting a kind of normal relationship. From the youth organization, the child or the daughter is getting a very good support from the youth organization. And from the school, also the daughter is getting a very good support. From the friends, also the daughter is getting a very normal support in two ways. And also to the son, also they are getting a very kind of normal relationship in both the manners. From the college, the son is getting a very positive or very intimate relationship, and it is a two-way manner. From public health sector, we can see that is a very weak relationship the patient is receiving. From the colleagues, they are getting a very normal relationship, both from the colleague as well as from the husband. From self-help group, the patient or the lady is getting a very normal support. So in this manner, we can explain the support the patient and their family is getting from the social community or social groups. So this is what an echo map is. Is there any explanations needed in this portion? Or can I go forward?
Yes, madam. You can go
Okay.
ahead.
Okay, thank you. So with this echo map, we have concluded all the contents or elements involved in the psychosocial assessment. Next, we are going to caregiver. So are we a caregiver? What do you people feel or believe? Does we are caregivers? You can put your opinion on chat box also. Do you feel that you are also a caregiver? Or do you have felt somewhere in your life that you have been a caregiver? No one? No one has felt as a caregiver in their lifetime? No, caregiver is not connected with doctors or nurses. It's like we personally feel like we are providing care either to someone, let it be a family member or let it be anyone close to us. We somewhere feel like, yeah, we are a caregiver or we had been a caregiver. Okay, I think I will explain this sentence. There are only four kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregiver and those who will need a caregiver. So in maybe in a family, someone may be having some kind of illness, or it doesn't mean that it should be a life-threatening illness. It may be a simple sickness itself. So on that time, we act as a caregiver for them. And as days pass, we should need someone to take care of. So on that time, we are chosen on someone to be our caregiver. So likewise, in this world, we can say that there is only four kinds of people in this world. So who have been a caregiver at present, who who have been caregivers in past, who are currently caregivers at present, and who will be providing some sort of care in future, and later on in somewhere in life who will need a caregiver. So yes, we can definitely say that we all are caregiver in some or the other way. Hence, do respect the caregivers, do acknowledge them, and don't ever dehumanize them by calling that you are a bystander. Because somewhere around we are going to be a caregiver, or we need a caregiver in a lifetime. So respect them, acknowledge them, and never dehumanize them. So based on all the psychosocial elements, what all interventions can be provided? We can provide them information or facilitate them by giving proper information. We can psychoeducate them. We can provide them supporting counseling, either for the patient or for the family. We can continuously get connected with them by through follow-ups, like whether they are okay or they are feeling any kind of troubles, does they need any support or not. Bereavement support, even after the patient's death, the family will be the family needs some kind of bereavement support. So likewise, also we can provide them support. We can rehabilitate them. For example, some of the families which we see after the death of the patients, the caregiver will be alone. So on those times, we need to rehabilitate them to a proper home care setting. We can facilitate them by providing informations. For example, there are some government schemes in Kerala where the caregiver is getting pension, like caregiver pensions are there, also cancer pensions are there. So based on all these knowledge, we can facilitate them that these are kind of schemes or provisions are there in our country or in our state, so that you can also get aware of and get connected to it. So likewise, so many kind of interventions can be provided after taking a proper good kind of psychosocial assessment. So this is a case study. I will just read the case study first. It's a 56 years old lady. She has been diagnosed with CA breast in 2016. She has undergone mastectomy and referred for pain management. She was looking very anxious and had no idea about palliative care. There were other comorbidities for her, like she's diabetic since 12 years. Also, coronary artery disease is there. Along with that, she had a fracture on her leg due to a fall in 2019. Moreover, she's a widow and her children are having a hostile relationship with her. She's also living in a rented house. So this is just a small case study, and yes, now you are going to describe each and every components of this case study. First, I would like to know about the physical issues or the physical aspects what this lady will be undergoing. So can you please explain either by unmuting or through putting in chat box? So my question is, I can tell once again, what all physical issues or physical problems is there for this particular lady after reading this case study?
Physically, she's a CF breast patient. the mastectomy is done, so the maybe the one part of the chest, the breast is removed. So the social stigma she must be having, that is one issue. She's undergone all the treatment, and thirdly she's having pain. So pain is another issue. Physical pain she is having, and social psychosocial issue is patient is a widow, and the financial is she is poor, I think, so she is staying on the rental house. So she is having a financial problem, social problem, and the physical problem.
Okay, thank you, ma'am. Also, I got few answers in chat box. Like, since she had done her mastectomy, she will be having pain related to that. Also, she has undergone fracture, and the psychosocial issue addressed is his financial rental house. Okay, so the physical part, what we can put in a box is that yes, she will be having pain. She's having some comorbidities also. That is, she's a diabetic patient too. Hence, she will be having difficulties based on that. Also, she is under coronary artery disease, and also she has a fracture on her leg. So these all are the physical issues what she has been undergoing when it comes to the physical aspects of the problems. Okay, then we can go to the psychological issues what the patient has been undergoing. So, what are the psychological problems that she might have undergone? You can put the answer in chat box also.
Psychological pain, maybe she is the patient diabetic and the coronary artery disease plus cancer, so she may be thinking why all these diseases to me at this early age. The diabetic and the cardiac issue is since 12 years. Afterwards she is getting see breast, so that question may be there, why me?
Yes, ma'am, definitely. That is a very good answer, actually. So she will be either blaming on on the spiritual aspects, like why all these things are happening to me, why only me is chosen for all these problems. So obviously, she will be having constant kind of negative thoughts in her mind, which is a psychological issue too.
Also she is a widow also,
Yes, also she is a widow, hence related to that
and
aspect, also she will be thinking. Yes,
financially staying in the rental house. So from all the sides she is stressed, so
yes.
definitely must be having a big question mark on her mind, why everything is to me only.
Yes, ma'am. Yes, ma'am. Thank you, ma'am. Also, in chat box, I have seen that she's a widow and her children relationship also makes her put into more kind of a stressful relationship, because even what she have in her family relationship is her children, but these children also is having a very hostile relationship with the mother. So again, that will trigger her more for the psychological problem. Also, she is looking very anxious. It seems that she has that anxious and more like what is going to happen in future, because she doesn't have any idea about the palliative care. Henceforth, she'll be more anxious regarding her future as well as about the disease also. So that also can be added in the psychological part. And due to all the negative thoughts which she had been thinking, she will be having some kind of sleepless issues, or depressive thoughts also can be a problem in the psychological aspects. So again, coming to the socio-economic part, what all the things is mentioned in this case study?
financially weak, and she's having a fracture, hypertension, cardiac plus cancer plus pain. So all this may be restricting to the to go to the social aspect. Either maybe moving out with a neighbor or with the friends or to the church, again a religious thing. Everywhere she must be getting a negative pressure, or she may not be able to go.
Yes, ma'am.
That is a
So she is financially stressed because, yes, she's having different kind of illness with comorbidities, and this makes her get away from going for work. So there is no breadwinner in the family as of now. So that makes a question mark in the financial aspects. But with that constraint or with that problem itself, she have to cope up with the education of the children, also the rental support, because she is living in a rented house. Again, that will again add a more financial problem, and making the children educated is also a financial or economic problem what she may be facing. And yes, so this is the four different aspects, all the points which we have been discussing on the case study. I have put into a small box. So physical, here he says that yes, of course, she's having physical pain. She's fatigued. She's having lack of sleep. She's been not been able to walk because she's having a fracture in her leg. And since the mastectomy has been done, she will be having body image issues too. So coming to the psychological point, isolation. She's living alone in a rented house. So obviously she will be having that isolation feeling. Hence, she's emotionally weak. She's anxiety about the future. She was telling that she doesn't have any idea about the palliative care. So yes, she will be anxious what will be happening on the upcoming days. She's not clear about the prognosis and the palliative care. So all these problems will add more stress to her. Also, multiple illnesses there, like comorbidities are present. Hence, that will also will again increase her stress. So coming to the socio-economic part, she's having a very strained relationship inside the family, because we can see that the relationship between the children and the mother is a very hostile one. Hence, inside the family, it's a very strained relationship. She's not been able to go for work because, yes, she's a CA patient. Her leg is fractured and other comorbidities are there. So she's not been able to go for work. Financial instability is present because there is no breadwinner in the family. Obviously, there are so many kind of financial issues are there. Then coming to the low accessibility to a hospital, like she's living in a remote area, henceforth she's not been able to go for hospital. There is no caregiver and no support system. Then spiritual aspects. Okay, sorry for that. So yeah, coming to the spiritual aspect, yeah, she's extremely spiritually distressed. As the Remini ma'am was saying, she's asking to herself, like, why all these problems are happening to me alone? Like, why the God has chosen me? So many physical distress is there. Along with that, the financial problems are there. So why God has chosen me? So of course she is extremely spiritually distressed, and that's why she is having all these sufferings. Like she had lost her faith in God, she has lost her connection with the family. She doesn't have any significant person in life because she's not been able to get dependent to anyone, even to her children. So she feels like she doesn't have any significant person in her life. And there is no memorable as well as joyful events because she's a widow and she has been undergoing this physical illness from her age of 12 years. So she'll be constantly thinking, yeah, that constantly thinking that she's not having any kind of pleasant moments or the joyful events in her life. So these all ask her question why this is are happening only to me, thereby cutting that good relationship with the spirituality. So, in this manner, we can assess and identify what all the psychosocial, spiritual, economic problems what a patient and his or her family is undergoing. Based on this, we can provide the interventions which we have explained before. So, this is how a psychosocial assessment is taken and interviewed. So, this is some few points which we have to remember. Evaluate our interventions. Just providing interventions. Initially, we provided one interventions, and with that, we have completed that. There is nothing like that because we have to continuously evaluate whether the interventions which we have provided is correct and perfect. So for that, in between, we have to take assessment again and again. Access of the patients and their families a benefit. Just only providing the intervention doesn't make that they have received what we have given, but nothing like that. We have to check whether they are being benefited by the interventions which we have provided. Also, revise or reassess all the assessments which we have been taken again and again, and thereby update in the sense we just identify whether they are psychologically, socially, economically, and spiritually they've been able to manage or not. Reach out for help if needed. This can be provided by continuous follow-up. Just look whether they are getting enough and support from us. For that, we have to be in a constant contact with the person and the family. And yes, there is an art and science in every psychosocial care, just as we provide medicine. So, with this, I conclude my psychosocial sessions, the psychosocial aspect in palliative care. You can ask me if there is any doubt, either through unmuting or through chat box. So thank you so much, everyone. I hope you had a very good session regarding psychosocial aspects. Yeah, thank you.
Thank you, Ms. Neeraja, for the wonderful session. Thank you, everyone, for participating actively and making the session progressive. Thank you. Let's see you in the next session. Bye.